My name is Orla Ryan. I'm a news correspondent with thejournal.ie, a news website based in Ireland. My project was called Falling Through the Cracks, and it explored how a lack of access to resources and services are impacting young people who experience psychosis or schizophrenia. Very often, if a person is experiencing psychosis but is also autistic or maybe has cognitive issues or other health issues, they're often passed from one team to another. So mental health services may say, no, we're not going to see them because they're autistic. They need to go to an intellectual disability team. Early intervention is so important, but when they're passed from team to team, their access to care is delayed. One of the things we really wanted to do with the series was kind of reframe the narrative around people who experience psychosis and schizophrenia. Very often in Ireland, when schizophrenia in particular is mentioned in the media, it's in relation to a crime because a person who happens to have schizophrenia has hurt somebody else. So we didn't want that to be the narrative. We wanted to look at the real lived experiences of people who have experienced psychosis and schizophrenia and show that people of all ages can get it, and when they do get access to timely and appropriate care, they can fully recover and lead a full and healthy life.
There's also a very interesting article in thejournal.ie.
When the series was raised in the Dáil in the Irish Parliament, it was great to see that happening because it meant that these stories are in front of the eyes of politicians and lawmakers and policymakers and people who make these decisions. We're hoping by this series and me continuing my work in this area that will have a knock-on effect of greater access to services and funding for services in the future. It's been a real honor to be involved in the fellowship, and I know for me personally this was not a one-year thing. I will keep writing about mental health stories, psychosis stories, stories about people with schizophrenia, and I wouldn't have done that without this program, so it's been a real honor to be a part of it and make these connections and continue this important work.